everybody that's not here is excused.
Yes.
So we need approval of the minutes from November.
I think I sent them to you guys.
Yeah, the email, yes.
Yes.
You did.
Approved, and second?
I'll second.
Okay. Any discussion? Hearing?
Aye.
Okay. Then no citizens, and I don't believe there's any unfinished business. So we're going to go over into new business and the administrative report and personnel updates.
Yeah, so Amy Kremski is our new public health nurse officially. She started on November 21st. Kowski's spot, so she's a 0.5 FTE, so she works Tuesday, Wednesday, and every other Friday. So she's already been helping out with immunization clinics, got her feet wet with COVID cases. So she's just working her way through orientation, and as interesting things come up, we sort of slot her into orientation, and as interesting things come up, we sort of slot her into those to get her feet wet with some other projects. So far so good. She seems to like it. She's a good fit with the team, so I think we found a good one. And then we still have contact tracers and doing all of our COVID. I might be looking to bring more on after the holidays if things stay on the trajectory that they're on, or transition some of our staff back to doing COVID more full time, which I don't really want to do because I like them having the break by tracers. So there's a chance that either I'll have Maxim give us another 1 or 2 people, or transition back to some of our staff doing a little bit more COVID. We have grant dollars to cover the costs, and our contract with Maxim is open-ended. So there's to cover the costs, and our contract with Maxim is open-ended. So there shouldn't be any problems with getting any more people in to do the work.
How long is the grant for?
So the one that I'm using right now is the Enhancing Laboratory Capacity Grant, and that runs through October of 2022. But then capacity grant, and that runs through October of 2022. But then there are the ARPA money, which runs until 2024, and then I have CDC Workforce Development money, which runs at 2023. So I've got grants to use once this one ends, if we need to keep. So I've got grants to use once this one ends, if we need to keep. Please no, but if we do, there's money for that.
Okay, then we'll go into community health assessment.
Yep, so in your packet is this little guy here, and the end of the year before the holiday. If there's anything you see that is misspelled, typos, a question that's just worded really poorly, the purpose we're trying to do is get a representative sample of the community. We're sending it out to the office, and we randomized 1,000 addresses, so it'll go out to those people. We're hoping for, 25-30% return or something along those lines. We gave a version of this survey as a pilot during our flu clinic. So our senior flu clinic, we had just over 100 people that came through the clinic that day fill this out. And then we kind of looked through it to see, what questions got some responses, some questions that didn't get responses, and then we had a few people kind of sort of see where we were asking the same question too many times and whatnot. So this is the pared down survey off of that pilot that we did back in September. So this would then go along with the data we collected from our key informant interviews and from the focus groups. The hospital system did their community health needs assessment, where they query, this year was a bit different. It was kind of an open-ended, hey, here's a website, come here and fill out this survey. So we tried to push it in as many channels as we could to get Franklin residents to fill it out. So we do have a couple hundred people that filled out the survey for fill it out. So we do have a couple hundred people that filled out the survey for Franklin through the hospital system, and the questions are very similar. So we'll be able to go kind of apples to apples with a lot of the themes and questions that are in here. So who knows? Maybe you'll be one of the lucky 1,000 to get one for real. So who knows? Maybe you'll be one of the lucky 1,000 to get one for real. But if not, this is pretty much what's going to be on there. But if you wouldn't mind looking it over, because we've looked at it over and over and over for months and months and months, so
Sure.
I don't really even see it anymore. I could probably recite it for you from memory. So extra eyes would be good. But any questions on kind of
I don't understand 4 and 5.
4 and 5? All right, let's see. What is 4 and
I
5?
mean, I understand what gender you identify as.
Yep.
Is that like?
Not
So-
today.
So it would be,
No.
gender would be male, female, that kind of thing.
Okay.
Sexual orientation would be straight, bi,
All of that.
LGBT.
'Cause I wouldn't know how to answer. I wouldn't know what you're looking for with answers there.
Yeah, so we left, there's a reason we left them open-ended, because, to be honest, we have a fairly large Middle Eastern population in Franklin, and what we've heard, at least on the adolescent level, is that when they're filling out surveys, they don't really know what to mark, because they don't really think of themselves as white, they don't think of themselves as Asian, they don't think of themselves as black, so they don't really know what to do, so they kind of just, people could, if it was a mixture, or if it was something outside of like the normal, 1 or 2 things that pop into your head, we would have the wiggle room to do that. But otherwise, you would normally see, if this was like a drop down or a pick one, it would be straight, gay, bisexual, those types of gay, bisexual, those types of questions or answers.
Got it.
And it's all completely voluntary and confidential, so there should not be anything in here that's identifiable. Everything that goes out has a self-addressed return envelope with it, so they don't even have to put the return address on it or postage or anything, so it should come back unidentifiable.
Nothing else under community health assessment. We'll go to strategic planning update.
4 documents that health departments have to have, and our last one was from 2018 to 2020, and I'm not sure how much the Board of Health was involved in drafting that, or if it was mainly Bill and Kristen that worked on it. But it's basically meant to be kind of the guiding document about how you're going to do what you're going to do and how you're going to make it better. So ideally, I would like to involve both the Board of Health and all of the staff in kind of drafting it and coming up with ideas for it. Sometimes a lot of people don't really know what a strategic plan is unless they've been involved in one before. So I'm looking at, with some of the COVID recovery money, bringing in a consultant to do kind of a strategic plan 101 workshop with a presentation of kind of, this is what a strategic plan is, so that everybody kind of kind of the importance of having as many people involved in writing it as possible. So I'm hoping to do that kind of after the holidays at some point later in January. And the topics I've sort of been kicking around, although I'm going to let the group kind of decide, but something along the lines of workforce station and some sort of QI performance management type of topics. So those are the 3 areas I'm looking at, or some variation of them, kind of developed by the team that wants to be involved with it. So more to come on that, but kind of wanted to lay the groundwork, and if any of you are interested in being that would be, I think, beneficial to bring your lens to everything. And I don't know, Henry, am I right in that that was basically Bill and Kristen the last time?
They put it together. He brought it up to the board,
Mm-hmm.
but we weren't part of really putting it together.
Okay.
Right.
And did you then vote on like
Really putting it together.
Okay.
Right.
And did you then vote on like adopting it or just
Yeah.
reviewing it? Okay.
Right. He went over it, and I think Kristen even came in and
Mhm.
kind of gave a presentation on it,
Okay.
and then approved. Yeah.
Mm-hmm. Yeah. So one of the things, when I've done them before, it was kind of even taking a step back and looking at like the mission statement and the value statement, and just making sure that that's still on par with what we're doing now. Sometimes those kind of age not so gracefully. So
Who is the Kristen?
Kristen Anderson,
Oh,
she was years.
Would you want to be part of it again, just because
Kristen?
you're part of the first?
She's out of the picture now.
Oh,
Yeah, I would say
okay.
no.
Probably not.
Probably not, no. But we do, that's why I wanted to bring in, I mean, it can be somebody, I wanted to bring in, I mean, it can be somebody as simple as somebody from the regional office with DHS coming in and doing it, or there are independent companies that do strategic planning, which I think brings a little bit more, a little bit more fun and a little less regulatory in their explanation of it than than DHS would bring.
Would this person possibly come to one of our board meetings?
Yeah, that's what, yeah, I would
Explain
have
things
them,
to that.
yeah, I would have them, do the presentation for the staff, and then I would have them come to a Board of Health meeting and do one as well.
Okay,
For the staff, and then I would have them come to a Board of Health meeting and do one as well.
okay, before things are, right.
Yep, exactly.
Okay. Anything under administrative? If not, we'll move into public health and the City of Franklin COVID updates.
So in this guy, if you go to, I kind of stapled it in a bad order. You go to the page that looks like this. It's going to be the start of the COVID information. So this is all as of Friday. A little chart at the top that we're hanging out in this case burden rate of between 500 and 600 for the last several weeks. For a point of reference, at this point last year, we were at about 1,200 to 1,300. So we're not as bad as we were last year, but I liked us better at the beginning of November when we were, down under that high burden rate. What we're seeing for the most part is a lot of families. So if one person in a house gets it, everyone's going to get it. And not as much in like school and workplace passing it, but those family gatherings or household settings, it's one person gets it, everybody gets it. And that's why some of the schools are kind of teetering right now. You've got 2 or 3 kids in the same school, and it only takes 15 kids to be positive to go over that 3%. It happens relatively quickly. So the schools are seeing a little bit of the strain from that because of the sibling piece. We are, I would say, from what I get every week of the county, for the other municipalities, we're basically right smack in the middle of where everybody is. They're either a little bit under us, a little bit over us. We're kind of right in the middle of where everybody is as far as burden rate.
Do we know ages?
Burden rate.
Do we know ages that are?
Yeah, so if you flip to the next page, you'll kind of see the top graph is where our number of cases that we're getting per week.
Yeah.
But then the bottom one shows you the cases by age. Now, this is since July 4th. So this is kind of when shows you the cases by age. Now, this is since July 4th. So this is kind of when things started to slowly tick up again. And then predominantly it has been that 4 to 17 group. If you break it down, we do have it broken down a little bit further than that, where we do by decade, 9, 10 to 18, that kind of thing. And when we break it down that way, it's the middle and high school is higher than the elementary kids, probably for a variety of reasons. But yeah, it's really being driven by our kiddos at this point. COVID vaccine stats. So Franklin, as you can see when you compare it to the county and the state, we're much better as far as adults 18 plus. There's been a very, very big lag with the state reporting adolescent vaccines, at least on the reporting system that and that tomorrow we should be able to get more data on kids, especially that 5 to 11 age range, which we didn't have up until this point. So hopefully I'll be able to get better numbers for that starting tomorrow. But for the adult piece, we are, as a community, much better off than the county and the state. Cases, we're at about 38% of people having a breakthrough infection, which means it's been 2 weeks since their last dose of vaccine. So if it was the 1-dose J&J, 2 weeks after that, if it was the 2-dose Pfizer and Moderna, 2 weeks after that, people have gotten sick. It's usually right in that sweet spot of 6 to 8 months from their last dose is when they're testing positive. And they might not even be that sick this time, but it's that 6 to 8 months where they kind of said things were going to wane and wax. It's happening. So that's why the booster is so important. Is so important because we're seeing all of these breakthrough cases happening right in that timeline. We don't have stats yet on breakthroughs with the booster. It's a little too early for that. But if we have them, they're very few and far between. And then we don't, if we have them, they're very few and far between. And then we don't have breakthrough cases yet for the littlest kids because they're just now hitting their if they went right away when they were approved, this is 2 weeks from when they were first approved. So they're finally just fully vaccinated from when they were first approved. So they're finally just fully vaccinated if they went right away. Any questions on the COVID stuff?
And then what about flu?
So flu, we're starting to see an uptick in hospitalized flu, which is early. Influenza A, I don't know, Dr. Golden, if that's what you guys are seeing too. So a handful of those cases came in over the weekend, smattering. And so they said that's about 6 weeks, 8 weeks earlier than normally we start to see those numbers take off. So starting to push flu vaccine a little bit more. We're going to do walk-in flu clinics during tax season here, so we kind of catch people as a captive audience. When they're coming in here, we'll just try to shove them straight down to us to get a flu shot if they haven't gotten it yet. So they can just walk in here, get a flu shot, and then back out they go. We're doing COVID booster clinics once a week. We're struggling a little bit to get Moderna vaccine. Not exactly sure why, but it is challenging, more challenging than it should be to get Moderna booster vaccine. But we're running those once a week. They seem to be filling up.
Is that currently happening?
Yeah, we have one tomorrow. No, the 15th. Tomorrow, so Wednesday we have one. Yeah. Tomorrow, so Wednesday we have one. Yeah. And we're running them a little bit smaller right now because we were burning out our volunteers. So we're kind of running smaller ones now to get through the holidays. And then if we need to run bigger ones, we'll have our volunteers a little bit more refreshed to bring them back for bigger clinic.
Do we know HN? Do we know what numbers there?
The only thing that we have is the influenza A.
It's A, okay.
Yeah, I don't think they've typed. At least the ones I've seen haven't been typed yet. To know if it is a match or not.
Yeah, we don't know yet, okay. What about other communicable diseases?
Yep, so that'll be the first 2 pages of your chart here. Purple is 2021 on the graph in front for referrals. I have the last, this year and the 2 years previous. I have the last, this year and the 2 years previous with the 3-year average, but take that with a grain of salt because 2020 and 2021 were COVID. So you can see November last year when I was talking about how last year was a lot worse than this year with the COVID numbers. Last November was really, really rough for us. The second page is more specific to communicable diseases. And I broke down that second chart there between September, October, November, what we were seeing that was COVID versus non-COVID related. Really weird hospitalized flu cases in September. November only 3, but when I ran the report this morning for December, we have, I believe, 8 or 9 already for December, and we're not even halfway through the month, so. But otherwise, nothing super alarming. which is good because we don't have the bandwidth for much more.
One question.
Mm-hmm.
When they come through as a breakthrough,
Yeah.
are the symptoms different, or how are they manifest?
It really depends. A lot of people aren't necessarily as sick as people who haven't been vaccinated. But then again, it depends on the person fully vaccinated that got moderately sick after being vaccinated, and other people who wouldn't have known it. They just had to get tested for work or for travel or something, and they tested positive. I should back up a little bit. And the school district has started a test to stay program, which staff member whose exposure happens at the school, they have the ability to, rather than quarantine at home, as long as they remain symptom free, they can continue going to school, but they have to get tested. And they partnered with Summit Clinical Labs to be on site to do testing. So they'll do thing right away in the morning for people that want to be in that program. And if they test negative, then they wear a mask and they can be in school that day. And then they test every 2 days for the quarantine period. So they're hoping that will help keep kids in school a little bit longer than sending everybody out school a little bit longer than sending everybody out on quarantine. They have, and I'm going to bumble their stats because I don't have them in front of me, but I believe their conversion rate of the stats they're keeping of all the people that have been quarantined from a school exposure, there's only the people that have been quarantined from a school exposure, there's only 1.2 or 1.3% that have tested positive after that exposure. So that's why they're comfortable doing that test to stay program just with people who are a contact from school, because when you move it to a contact from a household, setting, then that number is a lot higher for people getting sick. So if you're a close contact because your parent or a sibling has it at home, then you have to quarantine at home. You don't qualify for that program.
Is that just in the high school?
It's all of them.
Oh, okay.
Permission, so they will call when you get it'll go through the letter that you get will say that they have that program, and then you can give permission for the school to do it, or the clinical lab person to do it.
And then we'll move into,
So this is an update. I think I've talked about them in one of our previous meetings. We have a house in District 5 that is a pretty severe hoarding situation. Alderman Barber is aware of it. The house itself is, as family members were continuously going back inside the house, and it's not just like garbage and trash and fecal matter. There's also a pretty severe bed bug infestation, so we don't want people continuously going in there and coming out and reinfesting themselves. So the homeowner had the finances for her, and we're in the process of working through the court system to see if the court will grant the conservator permission to sell the home on behalf of the homeowner to get money to help pay for her assisted living expenses. Because without that, her money is going to run out relatively soon. So we're working our way through that. The next court date is January 12th. In the interim, the judge in the case has stated that if the 2 adult children that were living in the home could work something out with the city, they might be in the home, could work something out with the city, they might be able to go into the home to retrieve some possessions. So I'm currently working with them on a list of very strict criteria that they would have to meet before we would allow them to go inside just for their own health and safety, and not bringing anything into the community. So right now, the conditions are that they have to come up with the money to pay Paul Davis Restoration to take the boards off the door in the garage door and pay to put them back up. So So that's about $600. Neither one of these individuals is employed, and they don't have their own finances, so that's already a pretty significant hurdle. They also need to talk to Batzner or another pest control company and submit a pest control plan of how they're going to fumigate if it goes anywhere. Because what we don't want them to do is take the items out of the house, put them in their van, and then the van gets full again, and then they're full, and then they go to the library or a restaurant or something, and then it kind of spreads. Bed bugs are kind of like cockroaches, that they can live for 6 to 8 months. They just sort of move around, and there's a chance that they could be in electronics or in just kind of all over at this point. So we really need them to have a plan of how they're going to, whatever it is they're going to take out, that there is a plan of how they're going to treat that. And the third piece is they need to be protected in there. When the individual went in to price out what it would cost to restore the home, they went in a full-on PAPR respirator. Fire department went in a full-on PAPR. The very least, I was in there with an N95 mask, but that was not safe for any length of time. So they really need going to protect them in some manner, and then protect, again, the outside environment when they come out, that it's something that they can just take off and not wear whatever's inside, and take it back in their car to wherever it is that they're staying. So kind of a heavy lift for them. And it's not that I'm trying to intentionally put barriers in place, but I need to make sure that everything is done safely, because the environment is not safe. Also, the back door was left open for a duration of time before it was closed and boarded up. So the door was left open for a duration of time before it was closed and boarded up. So it's unclear if anything might have gone inside during that timeline. So again, I don't want people going in there and getting hurt. So so that's sort of where we are with that one, working its way through. So that's sort of where we are with that one, working its way through the process. If for some reason the judge decides not to allow the conservator to sell the house, then it might be back to the drawing board with myself and the council to try to figure out what the next steps are for that neighborhood, because the house really is not a safe place, and not safe to be in the neighborhood. So
What would be you mentioned a couple figures, what do you think it would be total to open it up to do this? Is it like $2,000 or?
to take all the boards off?
No, just get stuff out,
Yep.
take care of it, protect themselves going in, and then.
So depending on how much they want to take out and what it is, it's $600 just to unboard and reboard. And then I would say probably another $1,000 to $2,000 for Batzner to, yeah. And at this point, when I've spoken to them, they want some electronics like computer, DVD player, TV, that kind of thing. They know that the furniture is ruined, and that a lot of the like fabric type thing, electronics, and maybe a few keepsakes and that kind of thing. So, some of the things can be wiped down and you can look at it and see, okay, there's nothing on here, but other things like the electronics where things can crawl in.
It sounds like it'd be cheaper to buy a new
That's
one
what I
than
was just
to
gonna say, stuff is.
spend $600 to get it unboarded at a couple thousand, spend $600 to get it unboarded at a couple thousand,
Yeah.
They don't have money though.
Well-
Well, they do have a GoFundMe page, do you know if that's still active?
I believe it has been shut down. I don't know if they got to claim the money that was raised before it got shut down.
Because it was under some false pretenses.
Yeah.
That they were seeking money. Like we're not letting them in the house, and where the sheriff is, or the police department is the bad guy.
Yeah.
So what?
Courtney was the bad guy.
Yeah, I'm used to it.
Courtney's always
It's
the
fine.
bad guy.
It's fine.
I know what's.
What's new?
I want to say it costs to have the treatment.
It's expensive, yeah. Yeah.
So do you foresee the judge saying yes and awarding the censorship allowance?
I sort of feel like it's leaning that way, because in his
Is it Clement? Is it Clement?
I mean, it wasn't an order that we like a court order that we let them in, but it was more or less, you've got 40 days to work with the city to see if you can get in to get something, and 40 days was the time between the last court date and the next one. So to me, it kind of felt like he was going to allow them. Felt like he was going to allow them to sell it.
Oh, got it. Okay,
Yeah.
perfect. Okay.
Is it Fred Clement, the judge?
No, it's at the county level. It's a circuit
okay.
court judge.
Okay.
Yeah. Yes.
Okay.
So with that, we have some updates. We've been doing a really very popular class called Mind Over Matter, Bowel and Bladder, which I sat in on for Carol because she was out ill one day, and I was absolutely fascinated by it. It's a therapist from Aurora right across the street, and she comes over and she does a wonderful presentation on bowel and bladder health, and this was our third one. We have a waiting list that's still about 70 names deep for people wanting to. We have a waiting list that's still about 70 names deep for people wanting to listen to this. It's about an hour, 15 hour and 20 minute presentation. So we'll be running another couple of those in the next year because of COVID and spacing. We're only allowing 20 or 25 people. COVID and spacing. We're only allowing 20 or 25 people in the Phaedra room of the library, so we can spread everybody out. But pretty impressive waiting list to get in to see her. We did our stepping on class in the Phaedra room. Again, smaller classes than we normally have, so we could waiting list. A lot of seniors are anxious about kind of being cooped up and wanting to get out and make sure that they have their balance exercises and that type of thing to stay safe at home. So we normally do 2 a year. This year we did 3 of using their room so frequently.
Does it have to be the library? Can we use a school?
It doesn't have to be the library. We've been using it because we can rent the Phaedra room, which is pretty big, but it could be the school. The nice thing about the library is that we can use it during the middle of the day, where if it was a school, it would have to be like a weekend or at night type of thing. So, but we've done it.
Bigger area with the school. Than
Yeah,
the library.
and Carol's taken it on the road a few times. Like she's gone to Brentwood and done it for residents there. And I think she went to one other a couple years ago. Went to another one of the senior living facilities and did it for the residents in like their a couple years ago. Went to another one of the senior living facilities and did it for the residents in like their kind of community room. Mm-hmm. But a lot of those places haven't started up their programming, or it's very limited. So, and then on the other side of the spectrum for our kiddos, Kim Kringle was just recertified for infant massage, so we advertised that for moms, dads, caretakers of babies to learn how to massage them. It helps with bonding. It helps in a whole host of things that it works with. So she's offering that, and we do classes 2 or 3 times a year. And when Lori left, Lori was our certified lactation consultant, so she left, but Quinn, our nurse that started about a year ago, is going to a certified lactation consultant, so we'll be able to have a pretty comprehensive new parent package that we can offer the community. There's a lot of times, when you're a new parent, you have all the tools you need when you're in the hospital, and you go home and, oh crud, so hopefully we can offer some things to new parents that are stressed out. We're still doing car seats. We started that back up about 2 or 3 months ago, and Kim's pretty busy doing that too. So slowly but surely, in small, controlled cycles.
There's something that I got, I was watching it on TV, and I'm not sure, I'd have to do some more research on it. But it's a program about the brain. I don't know if anybody's seen it, but it's telling people how to massage your brain and keep it going and what to do.
I want to say late 2019 because we didn't really do anything in 2020. She had started up a kind of a mindfulness seminar with seniors, and they were doing, it was like a 3-part series, and each class focused on something else, but it was, you know, kind of based on keeping your brain active with, you know, either like different things you can do in your routine, or if it was like crossword puzzles, or just, you know, like different things that you could do just to keep your brain active and healthy. So we were starting something, and then we ended up having to stop it. So if you have thing, and then we ended up having to stop it. So if you have, yeah, definitely send it our way.
It talks about movement as well as what you do, games or singing, and all the things you can do to help yourself. So.
Yeah, and we have a very active senior population that likes being able to get out. And do things, especially now.
When I'm doing dishes, I dance at the sink now.
There we go. I like it.
When my brain itches, I just think of sandpaper, so it works. Okay, are we done with community health, or
I think
what
so.
about dog bites and that?
Oh, we'll get to it.
Okay.
No worries.
Then we'll go into environmental health.
Another one in my neighborhood.
No, this one is Alderman Holtfer. We'll start with, at November's meeting, I talked about how we had our state agent evaluation coming up and standardization. So that was done the week of November 15th. What you have is our, quote, work plan. So nobody passes with 100%. So basically you go through, you give them passes with 100%. So basically you go through, you give them, they look at your program, they go out with Angie at 3 inspections and watch her do what she needs to do. And then they come back with things that we were either missing or they want more information on based on what our agent requirements are. So this document is our work plan for the next 3 years. So within 3 years, we have to do these things. Some of them are pretty easy that we could knock off. You know, right away. Like for example, I did not have an expense report for 2018 to 2019. Well, that was an easy lift. I just emailed finance and got that, so that's already done. But there are some things like FDA retail standards program. That's kind of like, think of like being a magnet status hospital or an accredited health department. It is, here are these gold standards that the FDA has. Now make your program do that. It's not a requirement, but it's like kind of like the gold. Those are things they just ask us to work on and show progress, you know, every 3 years when they do their evaluation. So tomorrow we'll have the official sign off from the state where they'll go through this document with us, make sure that there's nothing else they want us to add to it, and then that'll be our work plan for the next. In November will be standardized again because that happens every year.
And now environmental health referrals.
Well, actually, I'm going to back up one more thing on licensed establishments. In this pile on 27th Street. We've been having some issues with when we have to do inspections of those twice a year. And one of the requirements in our statute as well as state statute is that there always has a way to contact a manager if they're not there. So, for example, the Silent Night Motel, the owner's not always on site, but there's a big sign on the door that says, if I'm not here, call this number. And that person answers the phone immediately. Other places, like, oh God, it was the Naughty Pine. Now it's Whispering Pines. That person lives on site. So generally they're there, but if not, they'll put a sign up saying, call me, or call the person in apartment 2 and they'll come help you. this particular place, we've gone help you. This particular place, we've gone there now 3 times, and the door to the office is locked. We can't get in. We know that they're there because there are cars and there's the camera, so we know that they can see us. They're just not letting us in. So we've tried, know that they can see us. They're just not letting us in. So we've tried, like I said, 3 times to do the inspection. We sent a letter via certified mail on the 23rd of November saying you have to let us in. This is a requirement of city and state code. We will get basically a warrant to come in and do the inspection. So Alderwoman Hanneman knows about the situation and will probably accompany us the next time that we travel over there. And we'll probably do so just with police at that time, just so we can. But they're in danger of us potentially requesting that the license committee take a look at having them maintain a license at this point if they're not there, because I mean with some of these places you need to have somebody there. You always need a little bit more problematic than others. So
does the state get involved with licensing at that point too?
So we license on behalf of the state. We're their agent. But whenever we've wanted to potentially talk about, to have them kind of call this owner in and basically say, why aren't you doing this kind of thing, and see if, that helps to rectify the situation before we have to really.
Which is Sherry as well.
Yeah.
How many times have you gone there?
3.
3 times now.
Yes.
So,
Yeah. So we did get the car. We sent this certified, and we did get it back signed. So we did make a courtesy call late last week, saying that we got this. This person signed. It was not the name of saying that we got this. This person signed. It was not the name of the individual who owns the place. So we just were curious who signed and what their relationship is. And haven't heard anything back. So like I said, when we go out there, we'll most likely have to take police with us to try to get in. And police with us to try to get in. And historically, this has been, not to this degree, but this one has been problematic for us from time to time in the past.
and then environmental health referrals.
Okay. So we have, the biggest thing we're working on right now is a dog bite case. So the story with this bite is left their yard, ran down the street a little bit, and bit somebody in the hand. The police were notified because the person who got bit went to the emergency room. Emergency room told us. We then called police and said, hey, do you know about this bite? So police went out, did their report, talked to the person who got bit, ran the address of the person who owned the dog, and found that in 3 other incidents since May of 2020, this dog has left its yard and chased people. Not bitten them, but chased them. Has left its yard and chased people. Not bitten them, but chased them. So the police department at that point in August issued a vicious citation to the owner based on the history that they had in their police reports. The bite was the first we had heard of this dog because the dog reported to us. But because police had the history, we agreed with their assessment based on the vicious dog definition in the code. So we then made a vicious dog declaration to the owner, which in Franklin, you do have vicious if you do 3 things. You have to post beware of dog signs at every entrance. The dog has to stay within the owner's premises, so that's either in the house or within a fenced-in enclosure, or if it is leaving your house to go to the vet, it must be leashed and keep your dog. So, went back and forth a few times, and the owner did put up a fence. It's not his whole yard, but he fenced in a portion of his yard for the dog. And so we checked out the fence and we signed off on it that, yep, as long as you take your dog on the leash from your house, take your dog on the leash from your house to this fence, put him in there to do his business, get the dog, walk him back to your house. It would have been ideal if you connected the fence to your house, but it's okay. Just put it on a leash and walk it back. As long as you do all that, you're fine. So turns out dog is kind of a problem dog in the neighborhood, and many people know of him because he just kind of always ran around off leash. And it's on Alderman Helfer's radar because the dog has his yard as well and has kind of gotten a little aggressive with him as well. And in my discussions with the alderman, it sounds like this dog has bitten other people, but no one reported it. So it kind of goes back to that whole, you have to report it if you get bit by a dog, because that's how this quagmire kind of gets started, because everybody wants to be nice and they don't want to tattle on their neighbor. But now you've got a dog who, all I have is one bite in police report, so I don't have this whole history to go by. So the individual who got bit is very upset because they also live in that neighborhood, so they've seen this dog kind of running amok, and they claim that the owner is not abiding by these rules and is letting the dog still run around in the yard and off leash and whatnot. But people are saying that it did, so it's turning into a bit of a thing. So right now, where it stands is we've told the owner that if we get a confirmed report that this happened, that the dog will have going on right now. And we've told the individual who was bitten, who is keeping tabs on the situation, that they need to provide us with something more than just, a phone call saying, hey, yesterday at 2:00 I saw the dog running in the yard. We can't prove that. So, if I drove by and I don't see it, that's something I can do. That's where we are with this particular case. On a bigger picture, Alderman Helfer has asked for a meeting with the health department and the police department to kind of look at our municipal language about bites and how dangerous dogs and vicious dogs are defined. What can be done to help notify neighbors, if anything, if a dog is declared dangerous or vicious. What are some other things that we could require potentially an animal owner to do outside of what's already outlined in the ordinance. So we're meeting on Friday to kind of talk about big picture animal bite, potentially maybe some ordinance changes as a result of some of the things that are happening with this particular case.
Something on like a public information. Something on like a public information piece on that, because I know in my neighborhood that dogs attack dogs. Mm-hmm. And it gets kind of vicious. You can have 13, 14, 15 puncture wounds and something like that. Mm-hmm. And they don't want to report it because it's a neighbor, but a dog is the primary first alert kind of thing. They get out of the house, they run down the street and attack a dog. What's going to say it's not going to be a child next or something? But there's something in the police department that says there's officer discretion. I've never heard of that. But they say that it's officer direction. Yeah. And I think that has to get firmed up.
Yeah, and there's also a little bit of gray area between health department and police department with who's doing the quarantine orders, who's responsible for making sure that the animal owner, whoever, in for those vet checks and getting the quarantine paperwork back timely. So right now that responsibility sits with police instead of over the health department, which neither here nor there. It's just, it's not the most important thing on their radar most days because they've got many other things that they're doing.
They have to be made aware to call
Mhm.
all of those because potentially it could be more dangerous to, like you say, a child
Yep,
or an
exactly.
elderly person or something. That's where it has to start to happen.
Walking home from school, yeah.
Yeah, so I'm having Quinn in some of our neighboring municipalities just to see kind of how it's written out there, how they respond to animal bites, so we have some frame of reference to see what our neighbors are doing, and see where we can maybe shore this up and make it a little less gray, not necessarily like more like raw enforcement heavy, but like where can we make it a little less gray and a little bit more detailed on who does what and who has responsibility for certain things, following up on bites, and then for the animal owners as well.
If they have to take the dog out of the city, what are their options?
There's really two. Putting the dog down with, paperwork that says that happened, or if the dog is, given to a relative, in a different city, we would need, some sort of paperwork to show that
I don't know if
occurred.
there was some organization that,
If they bite, no. You can't even. If you try to give it back to MADAC or the Humane Society, if you say that it bit, they will take the animal if it's a biter.
Because a lot of the dogs are rescue dogs that I have experienced, or rescue dog situations are where it comes from. Not all of them, obviously, but
right,
I'd say that the four I know, 3 of them were rescue dog type situations where they have it.
Yeah.
And nobody wants to hurt a rescue dog or.
Yeah. So that's where we are with that one. It's gotten a little bit deeper than most of our dog bites do, but in the end, maybe a good thing that we take a look at some of the bigger picture. Items with it.
especially if it's a multiple
Mhm.
offender, yeah.
Yeah.
Is there any other new business or communications? If not, we'll need a motion to adjourn.
Do you anticipate the next meeting?
Yeah, what is the second Monday would be the 10th of January, I think? Hold on, let me look here. Yeah, January 10th?
Okay.
Motion to adjourn.
Hearing none, all in favor of adjournment?
Aye.
Okay.